Good morning, everyone, and thank you so much for joining us today to talk about the federal and New York paid leave benefits now and in the future. We have many members on today, and we welcome you as well as new friends. And we even have a member of the press who we welcome as well. Everyone is grappling with the consequences of the COVID-19 pandemic, and some of us really with unthinkable losses, but all of us are coping with the economic fallout and the fear that comes with that. So we're holding this call today to do what we can do, which is to give information which you can then share and use and get that information out far and wide. So all the people who are having so much trouble right now can get the help that they need with the many laws and regulations that have been passed recently, and then some that are going to come. So today's discussion, we're going to try to make sense of a maze of new laws and regulations that are going to govern these benefits that workers can use. Now, some are emergency and some will be permanent. We have two experts today who've been on the forefront in New York of this fight, and they are invaluable members of the Power Network. That is Sherry Lewant, who is co-founder and co-president of A Better Balance, and Blue Carriger, who is speaking today as the coordinator of the New York State Paid Leave Coalition and the campaign manager of Citizen Action of New York. We thank you for being here. They bring a wealth of information, and they're going to help us do some of the following. Can we go to the next slide? Oh, you know what? Let's just, so everyone knows, you can go to ask, that's fine. Just as for housekeeping, for those of you who are tuning in, as you have questions, put them in the question and answer function that's on your screen. You can also use the chat function as well. And if you're just on a phone call, you can email questions or problems even with the webinar to info@powherny.org. You can also send resources and other comments through the chat. Next slide. So what are we going to do today? We're going to focus on the paid sick leave victory to start out with some good news. And then we're going to try to make sense of the benefits for all of the things that we'll talk about today and the deficiencies of the coverage. We're going to share ideas, getting information out to our networks and hard to reach constituencies like folks who cannot be on the internet and they don't have access to a lot of information. And we're going to spotlight something that's really critical, and that's who is not covered yet by the emergency and some of the permanent sick leave benefits. So we're going to start out with Blue Carriger to talk about that part of it, and then we'll move to Sherry to talk about the maze of emergency laws, and we'll go back to Blue to discuss what's missing in the law and how do we help change that. So let's get started. Blue is a lifelong advocate for equality and justice. She spent about 17 years at Planned Parenthood of New York before she was moved to be a statewide campaigns manager for the worker and gender justice at Citizen Action of New York, where she played a leading role in the successful campaigns to win paid family leave and paid sick days. In 2007, Blue helped start up the Empire State Campaign for Childcare and continues to organize for that really important issue. She's speaking today in her capacity as a coordinator for the New York State Paid Leave Coalition, and which is part of the network called Family Values at Work, which is dedicated to building a world where all workers are valued, where all children can thrive, and where all people have the opportunity and the ability to care for themselves and their loved ones. So I turn it over to you, Blue. Let's start with something really positive.
Thank you, Bev. And if we can put up the next slide, that would be great. I'm guessing that we have quite a few people on the call who helped in one way or another to promote paid leave, whether it was the Paid Family Leave campaign, which was successful and now provides, next year will be fully rolled out, but even this year provides 10 weeks of paid family leave. But now we can add on to that statewide permanent paid sick days. And that's a great victory. Work on that started so long ago, and Sherry was a big part of that, a better balance. You know, there was a lot of advocacy in New York City before I ever entered this field. New York City was, you know, the first in the state to pass it and has a very strong paid sick days bill. In the last couple of years, we ran campaigns in Westchester and in Albany. And all of that built momentum, which the governor definitely saw. Momentum was building around the United States. And the beginning of this year, before we ever hit COVID-19, the governor did champion this in his State of the State address and included it in the executive budget. And then the coalition leadership, again, including Sherry, but many others who may be on the call, worked with the staff in the governor's office and kept up momentum even as we went through the COVID-19 in and out of the budget, et cetera, but finally got passage. And we have a very strong bill. The accrual will start 180 days after the passage, so around the beginning of October. And then workers will be able to use their accrued hours starting on January 1st of next year. As is true for most of the other bills, the time accrual is 1 hour for every 30 hours worked, and it's available to full-time, part-time, hourly workers. Can be used for personal or family short-term illness, diagnosis, preventive care, and very importantly, it includes safe time, and that is to use that paid sick time for issues and services related to domestic violence, sexual assault, and sex trafficking. The definition of family is a strong one. It includes spouse, domestic partner, children, siblings, parents, grandparents, grandchildren. You know, we still are working to push that a little further in the future. We would like to see that include people who are not necessarily blood relatives, but whom a very small population, but important population may have relationships where they depend on someone who is not a family member, an immediate family member, but is still the person that they most rely on for their care. Next slide, please. And the way that it is divided up in terms of the number of hours that an employer is obliged to provide, 40 hours of unpaid sick leave if you're an employer with less than 5 employees, and if you have less than $1 million of profit. So that's a little new caveat in there that says, you know, if you're a small employer, but you're still doing pretty well, then you can't just provide unpaid sick leave. You have to provide paid sick leave. So 40 hours of paid sick leave, and that's a mistake there, but it should be more than 5 employees and more than $1 million in your profits. And between, you know, 5 and 99 employees is the employee number. And finally, a little bit of up there for 100 or more employees, so 56 hours of paid sick leave. So, you know, it's a good standard. Other details in there that you can see with fact sheets. ABB has a great fact sheet, and I think there's a link to it on the Power site. But a good, solid, strong law. And now our task is really to watch as the regulations are written and making sure that as the small print goes in there, that we provide as strong and as broad a coverage as possible with good enforcement and good public education. I think that's, you know, we'll leave it at that. We don't want to spend too much time here. There's a lot of immediate stuff. This is not going to happen until January 1st. So again, appreciation of all the people in the coalition and others who helped make this possible. Appreciation to the governor for his leadership. We will keep you informed and keep watch as we get to the regulation portion of this law.
Great. So we'll go to the next. Terrific. Thank you so much, Blue, for that overview. I really like starting out with something positive. All of this actually is positive because they're very important benefits, but I'm really thrilled to have Sherry Lawand on the call this morning to talk about some of the work that she really helped move forward. And we thank you for all that work, Sherry. Sherry co-founded A Better Balance in 2005. A Better Balance leverages the power of the law to ensure that no worker has to make the impossible choice between her job, their job, and their family. Prior to that, Sherry was an adjunct professor at CUNY Law, had a long career as staff attorney at Now Legal Defense and Education Fund, and worked on the issues at intersection of women's rights and poverty, reproductive health, violence, and childcare. She also brought her legal skills to the Welfare Law Center, Department of Health, Education, and Welfare, and was an assistant U.S. attorney in the Southern District of New York. Sherry, thank you so much, and please let's go through your deck of slides, and you have so much information to share.
Next slide. Yeah, next slide. So yeah, there is a lot. There is a lot, and it's very complex. But it is important for people to know about what's available right now in light of the coronavirus, and be able to access it and be able to understand it. So we've had we had two major pieces of legislation pass Congress. The Families First Coronavirus Response Act, which I'll refer to as FFCRA, which was effective on April 1st. Which gives paid leave in two parts. So for those still working, that's really important that for the first time in the nation's history, we have a national paid sick days entitlement. It's only around this particular illness, but it is there, and it is something for us to build on for the future. So we're really actually thrilled, despite its deficiencies, that it was able to pass Congress. The other bill, the other law that was enacted on signed into law on March 27th and effective just then, is the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, which expands unemployment insurance for workers all over the country who are facing the fact that they can't go to work, that they've been laid off, that their businesses have closed, and that also is extremely important. The Families First paid leave provisions will sunset on December 31st, 2020, just in time for our New York State paid leave law to come into effect. So next slide. In the Families First law, there are two kinds of leave. One is emergency paid sick leave, and the other is emergency family and medical leave. The emergency paid sick leave is for a vast variety of purposes connected to the coronavirus, and it's 80 hours for full-time workers and proportionate for part-time workers. The emergency family and medical leave is for school closures, and that's an extended period of full FMLA 12 weeks. So those are the two parts of the FFCRA. Next slide. Again, this only applies to sick time needs related to coronavirus. It applies to public agencies, regardless of size, and to private entities that employ fewer than 500 employees. So that is the big carve out that we are concerned about and disappointed in. And that's that the largest businesses, those over 500, are not covered by this law. And rulemaking has also broadened some of the exemptions, two of the other exemptions in the Act, one of them for healthcare providers and emergency responders, and that's been broadly defined in the regs, as well as small businesses, which can exempt themselves if they feel that they are going to, that they would not be able to continue to function if they were to give this leave. It's not a complete exclusion, but small businesses get to decide without any application or anything like that. So the question of whether this will apply to you if you are working for a small business is up in the air. Next slide. So what you're entitled to is 80 hours of emergency paid sick time, and part-time employees are entitled to a proportion of that. Next slide. Next slide. And the purposes are very broad, as opposed to New York State sick leave, emergency sick leave, which I'll talk about in a minute. Almost anything related to the coronavirus that is making it so you have to stay home is covered by this, if you are covered in terms of your business size and not being a healthcare responder. This is the breadth of it. If you're sick, if you're showing symptoms, if you're subject to an order of staying home, and that does include shelter in place. It does include the pause order that the governor has issued here in New York. So and if you're caring for a son or daughter, if their school has been closed. So it is a very broad, purposes are very broad under this act. Next. You are, for that first 80 hours for your own, if it's for yourself, you're entitled to your full salary. For care of others though, only 2/3. And that includes the school closures as well. That would be 2/3 of your, and there is a cap on each of those as provided here. Next slide. The nice thing about it is it's available for immediate use. You don't have to have, for emergency paid sick leave, you don't have to have worked any number of hours for your employer. You can just get it. And you're job protected. You should be using this before you use any other sick leave. That's in the bill, and it is additional, but you have to use it first. And nothing in the law diminishes any of your other rights or benefits. Next slide. In terms of the expansion, the 12 weeks, that is just again for school closures. And for that, you do have to have worked for 30 days before you're entitled. But that is for any of the school closures because of coronavirus, and you can get up to 12 weeks. Next slide. To help small businesses and others, well, all businesses that are covered under 500, to pay for this, there are tax credits that the employers can get up to the full amount of the sick leave that they have paid. Next. So that's the federal, and the federal comes first. Only workers who are not eligible for federal paid sick are eligible for the New York State emergency sick time, unless the New York State emergency sick time would give you more or better benefits. So generally speaking, you won't be covered for New York State emergency sick time if you're covered for federal law, under the federal law. So the key covered group under the New York State law will be employees who work in businesses of more than 500 and healthcare workers and emergency responders who are not covered under the federal law. Next slide. The purposes, it's a very narrow set of purposes under the New York State emergency sick time. As Blue can tell you, we fought very hard to try to broaden the purposes, but at the moment it only applies if you have an actual order of quarantine that's directed against, to you or a child in your care, or a family member. So this is narrow. It's very narrow, and the emergency specifies, so that the pause order, I just want to make the point for the New York State emergency sick time, the governor's pause order is not good enough. The mayor here in New York saying you have to stay home, that's not good enough. You have to have a personal order. And qualifying orders are only for if you've tested positive if you've been in close contact with someone who's tested positive, or if you've been exposed to a person who's tested positive. So that in and of itself is narrow. What we have gotten them to do in terms of the regulations and FAQs is to say that if your healthcare provider has told you that you need to be in quarantine because of any of these reasons, you can use that as a reason to give to your employer, and in the meantime try to get that personal order, because the health departments and boards of health are totally swamped, as you can imagine, and as they have other things that they need to worry about. So you have 30 days to get that order. What will happen, and we will continue to watch this, once those 30 days elapse, we will try to get the state to say that it's okay if all you have is the doctor's order. But at the moment, this is a situation. So if you do have symptoms, if you come within this narrow group and your healthcare provider is willing to say, no, you qualify for an order, that should be enough. Next slide. Coverage is for the duration of the quarantine, and it's tiered in similar ways to the permanent paid sick time. It's a little different though. Employers with 10 or fewer employees, for those workers, you're going to have to go to the paid family leave, the special temporary disability and paid family leave fund, which has been set up for this purpose. Employers with 11 to 99 workers, your employer should be giving you 5 days of paid leave. And for any additional time on your quarantine order, you'll need to go to this special fund. Employers with 100 or more employees are supposed to give 14 days of paid sick time for these purposes. And public employers, regardless of size, also 14 days. Next slide. This is about the special fund. It gives the special fund under this will give you more money than the normal paid family medical leave, and those numbers are up here in terms of what you're entitled to. And I think these slides will be available, and they're also in our fact sheets. We have a lot of information in fact sheets and FAQs. Next slide. You should know that the emergency sick leave, like the federal, does not count against your general entitlement to sick leave. It's not available if you're not sick, and you can safely continue to work during the quarantine. It is available for immediate use. And again, in terms of retaliation, you are protected against any retaliation from your employer for taking this time. Next slide. I just want to quickly talk about the general paid sick leave laws that are in effect. One in New York City and one in Westchester County. Our New York City law has been in effect since 2014. As Blue said, we fought very, very hard for that law as one of the first in the country, and we're very proud of it. And that gives you 40 hours of sick leave. And of course, you can use it for your own illness, including corona, or caring for someone who's ill, including corona. And it also has a provision that closure of your of your place of business, or closure or school closures due to a public health emergency such as this does qualify as a usage for New York City and Westchester paid sick time. In Westchester, the law also includes a provision that if you need to quarantine, you are covered and you can use these 40 hours. So if you haven't used them already in the year, you are entitled to use them for these purposes, and people should just remember that. Next slide. So just briefly, we're not unemployment insurance experts, but we're trying to come up to speed on it because it's become very, very important in this pandemic. The CARES Act had three expansions of unemployment insurance, and people should just be aware of them. The pandemic emergency unemployment compensation part of it is going to give 13 weeks of additional unemployment benefits in addition to what the state gives now, which is 26 weeks. So that's good. The pandemic unemployment assistance, which is very, very important because it's covering workers who are left out. Those who aren't eligible for regular unemployment will be eligible for special benefits up to 39 weeks. And a lot of the groups who are left out, people like independent contractors, people who are working and haven't had quite enough time working to be covered, all of those people will be covered under this special provision. And it covers the period from January 27th, though, so it's retroactive, to December 31st of this year. In addition, as you probably heard, there's an additional $600 a week that has been added to the base unemployment benefits, whatever you get, no matter how low your income is or during the period. If that gives you a low unemployment benefit, you still get the $600 plus. So everybody gets that who is found eligible for unemployment now, if the reason is because of the coronavirus. So those are just important to remember because there are a lot of business closures right now and a lot of people are out of work. Next slide. So just wanted to put this up here. We have a lot of information on our website. If you know, I've gone through this quickly, and I know that there are probably questions that we may not be able to answer all of them today. So I would say, please, we have a special coronavirus page that has all of our fact sheets and all of our FAQs. Please go there. And personally, if you need help or you know somebody who needs help, we have a hotline. We are trying very hard to keep up with it. It's really increased, as you can imagine, but we really are trying to get back to people within 48 hours. So please do call, that's our number. And thank you for having me, Bev. I was really happy to get this information out.
Thank you, Sherry. That's fantastic. Well, Sherry covered really a lot of folks. There's a lot of folks that are covered. But in our advocacy community, what we're concerned about are people who are left out. And really that's, knowing that isn't enough for us. You know, we, Power and all the advocates are looking at that, and we have to find ways that we can change that and influence it. So Blue, can you take us through some of the gaps and some of, you know, the plans to you know, see how some of those can be filled. So go to the next slide. And Blue.
Sure.
Great.
And just want to, remind everybody there is going to be significant time for Q&A here before we leave. So if you have questions, I saw a few pop up in the chat for Sherry's presentation. There will be some time for that at the end. Before I get into the gaps in paid sick and family, I do want to acknowledge that, you know, there are now 22 million applications for unemployment insurance, and a huge part of this country that is past the point where they're looking for paid sick leave. They're trying to figure out how to pay the rent and keep the roof over their head, and feed themselves and their families. So this is focused today on paid sick leave and paid family leave. I'm sure Bev and others will be addressing some of these other issues in the future. We have huge issues of poverty, and we all know, I think, and observe how much this pandemic is just revealing in stark terms the inequalities in our country, whether that's through race, gender, or class. And those who have been institutionally and structurally discriminated against are feeling this much more severely. So with that said, I want to just address in this short time a little bit of the outstanding parts of the gaps here. And we already mentioned the huge ones. So employers with more than 500 employees were written out of the Families First federal paid sick days and paid leave law. So this is your Walmarts, this is your Targets, this is your big grocery store chains. These are huge numbers of people who are now cashing people out at the grocery store who are in constant contact with consumers and are exposed, and yet they don't have coverage. And the assumption that was given, the defense that was given, was that many of these people are already covered by large corporations, and that the corporations would voluntarily provide this. But that is not the case. I do want to note right now that just as of yesterday, New York's Attorney General has filed a suit on behalf of one portion of the people left out, and that's healthcare workers. But there are large numbers of people who aren't able to take the paid sick and family leave. In New York, the fact that New York City has a paid sick days law, it's not nearly as much time as people would like to see, but it's there. And the fact that we have paid family leave insurance creates some kind of net so people don't fall through completely. But this is a huge, huge gap that we need to fight against. That represents an estimated over 6.5 million people who are not covered by Families First. Next slide. The waivers that Sherry referred to for Families First. So the idea of having a waiver seemed good to begin with. All right, if your business is really at risk and you need to figure out how to be able to provide this paid leave. Okay, but what they have now in both the law and the interpretation of the law, and we've had a really exceptional broad interpretation of this law by the United States Department of Labor. So that, as Sherry mentioned, basically a business can decide on their own. I can't provide this. I'm not going to provide this. And there's no real review by anybody of that decision. There's some broad guidelines, and then you can say no. We've got healthcare workers, clearly healthcare workers on the front lines. This is, and other essential workers. This is where the district attorney from New York State is really trying to find another solution or push back against this big gap. We have some inclusion here, and I would say it's a positive that a lot of these laws are addressing gig workers, independent contractors, cell phone businesses, but a tax credit can be a long time coming, and what's needed is some immediate relief for these groups. Next slide. I said we won't go too much into the UI and cash benefits, tax credits, but I will point out that domestic workers, they're often either self-employed or considered very small businesses, and often they are on the front lines. They're providing cleaning services, they're providing caregiver services, so very much at risk, but could be carved out. The immigrant population, it's important that we are seeing laws here that are broad enough to cover illegal immigrants, but still there are challenges with them being able to continue with Medicaid coverage or access the kind of cash payments that other people have been able to get. The child care workforce and child care network is in a huge crisis over this, being told on the one hand they're essential workers, but not having the guidance, communication, funding, or supplies to really create a safe environment for the children that they are expected to take care of. And they're very small businesses that are on the brink of closure all the time. So there is a very strong effort to try to address the child care provider situation. Next slide. So there are strong and important efforts to address what's happening to incarcerated individuals, what's happening with domestic workers, what's happening with child care And hopefully, slowly, some of those advocacy efforts are starting to come together in a somewhat coordinated fashion to fight together for the next stimulus package, and making sure that it addresses some of the gaps and some of the needs that have become apparent. But we have an opportunity now to look at and see what it means not to have established, along with all of Europe and most of the world, permanent paid sick and family leave for all people. And that's an effort that we need to take now, and we need to build on this moment to work to establish that permanently. We need to mandate paid leave for the larger companies. We need to review and have more restricted waivers for small companies. And we need to make sure that the family care, paid family leave, emergency compensation includes adults, not just children. There are many people who have to care for adult family members, and that people get full compensation and not just partial compensation when they're out. So there is a national effort to pass what's called paid sick and family leave for all, and we are a part of that. Next slide.
Paid leave for
We mentioned here already essential workers. Besides paid leave, paid sick and family leave, we also need to advocate for them to get hazard pay, to get enforcement of safe and healthy workplace practices, and to get the clothing, masks, and testing, et cetera, that they need. So we're telling people and calling them heroes because they are stepping up, or because they have no choice but to step up and continue to work in this environment. But we're not providing them with the protections and the support that go along with that. And making sure that all of them have access to paid sick and family leave is critical. Next slide. Advocacy efforts around this right now come in many different forms. The first thing that's very, very important is, if we're going to be able to advocate for this, we all know how important it is to share stories. So there are a number, I know, ABB, Family Values at Work, many other Moms Rising, many organizations are have platforms in which people can share their stories about how they have been left out, or how they're struggling to get access to paid sick or family leave, or to other benefits they need to survive. So there will be links to those platforms on the PowHer website, and I hope you will use them, share them with family, with colleagues, with your members. We need those stories to be able to effectively advocate to fill the gaps. There is a letter circulating now from Family Values at Work that was put together by worker leaders around the country, addressed to members of Congress about the need to fill these gaps. And they're looking for thousands of individual and organizational sign-ons. So there is a link to that as well. There's a very important women's stimulus package that has been proposed, and I think many people within PowHer would support the many demands that are a part of that, and that link is also on the website. And then, as I said, there is a national effort to use this moment to establish paid leave for all. So universal access to paid leave by the year 2023. And so we'll all be working to try to do that. We have, I love the Republicans at this point. I think John Oliver had a wonderful show the other day where he talked about paid sick and family leave. And one of the points he made is that, you know, Republicans saying, look out, that Democrats are gonna wanna make these things permanent. And my gosh, yes, we do, you know, that we need to see, recognize what's happening to people today, what's needed, why it took a pandemic to see what's needed and how important it is to establish a floor of universal access to paid leave as soon as possible. We should be able to do that and go forward with that.
Great.
Okay.
Yeah, let me just add, I mean, I just want to lift up the paid leave for all. We are, part of that. It's a national, it is a consortium of national groups that's working together really, really well, including all the Family Values at Work, which Blue's organization is a part of, ABB, Moms Rising, CAP, National Partnership for Women and Families. We are really doing as much as possible. You should go to that website. That's where the advocacy is happening right now. All of the letters that that Blue was just talking about. We also did a letter to the Department of Labor on the gaps in the regulations or where we disagree with them. We have a call tomorrow. So please stay in touch on those, because this is a movement that goes well beyond the coronavirus, as Blue is saying, to really establish rights permanently to paid family leave and paid sick time. And this is a moment for us to really mobilize. And I think this is the best vehicle for really trying to push this forward. So please be in touch.
Wonderful. Those are just great suggestions. And thank you for lifting up that effort. For those who are member organizations of PowHer, we did send out the letter that you can sign on to. And PowHer doesn't sign on, our organizations do, because we have to have consensus, and we just haven't been able to do that yet. But we do all the outreach we can, and we will do make as loud a noise as we can through social media, through calls, encouraging folks to sign on to that. So that really is a critical, it's a critical moment for that. And I totally agree. That's where we have to push right now. In addition to the places that we have a little bit more time to. There are a number of questions, of course, but I think there could be more. So I'm going to encourage you to still, throw your questions into the hopper. And if we don't get to them, then Sherry or Blue or someone will connect with you and try to get to the answer. So. But let's start out with just some nitty gritty stuff. And Sherry, I think there are a couple of questions. Can you see that on the chat?
Yeah, I'm looking at them, and I'll address them in order. Except there was one that I really wanted to lift up, which is about domestic workers, because there might have been some confusion about that. They are definitely covered by the by Families First, by the federal law. And actually, the question is about tax credits for the employers of domestic workers. We believe strongly, and we have no reason not to believe this. I think it's really true. You can get a tax credit as a domestic worker employer for the payroll taxes that you pay to that domestic worker. There is absolutely no exclusion. There's no problem with that. There has been some confusion, I think, because you are not a small business in the sense that you can't get the small business loans because you won't have the EIN that you're supposed to have, but you can get the tax credits. And I know that has been a discrepancy that people have been really concerned about. So I just wanted, if people are having problems either getting the tax credits, or if domestic workers are having problems getting the sick leave, please let us know. Okay, so Bev, do you just want me to go through the chat?
I think so. There are some of those nitty gritty things. Let's get, because, and then there are a couple more I'll just give you. Okay. All
right. So there's a question around PTO. Generally speaking, PTO counts for sick leave in the New York City law, the Westchester law, and also now in the state law that'll go into effect in January. However, the coronavirus laws, the emergency laws, are different. You have to, the question is, do we have to give the sick leave for the coronavirus separate from PTO? The answer is yes, you do, as an employer. This is separate. It's first. People should take it before they take the other leave that their employer might offer them or might be entitled to under other laws, but it is also additional.
Sherry,
And
on that point, I think we can also emphasize that it's important that people know they can't be forced to use their company's paid sick leave if there is a company policy before they apply for federal or anything else. Sorry, that's a choice they can make to use eventually. But Family
it's
First
not
is
an
needs to go
application.
first.
That's the other, I mean, it's paid sick days. The employer is supposed to be paying it. So it's paid sick days. It comes first. It, as Blue says, it doesn't, it doesn't substitute for anything else that you have. So that it is additional, but it is only for the coronavirus related sick leave purposes that I articulated in my presentation. We have a question on how do you get a personal order of quarantine. The regulations or the FAQs that they've issued, the state has issued, indicates that you're supposed to get it from your Board of Health, your county, some kind of Department of Health. As I said, there has been a recognition that that may be difficult at this time when these are departments and agencies that may have other things on their mind. So if your doctor says you are eligible, and again, I listed what the purposes are for which you can get a quarantine order, then that should be enough for you to take to your employer right now. But you have to apply to the Department of Health or your Board of Health for the order. And those entities should know about it because it's coming from the state. Again, if you're having problems with that, please let us know. And don't,
just the order to stay at home doesn't qualify.
There is a 30-day period, grace period for getting that order. So don't expect, because I really don't think you can reasonably expect to get one that quickly, considering everything that's going on.
There was a question about on the Q&A. It's kind of hard to go between the chat and the Q&A, I know, about furlough versus let go.
Yeah.
So,
I know. That comes up all the time. And it's a word. And the fact of the matter is, if you are no longer being paid by your employer, if you are not being employed in the sense that you have work, you are eligible for unemployment. And we're not unemployment experts, as I've said before, but I've done a lot of these webinars with the National Employment Law Project, which is definitely an expert. And they go crazy. It's like, no. It's just, if you're still on the payroll, then you are entitled to sick leave. If you are, but if you have basically if your employer has said you're not on the payroll anymore, we're not paying you, then you should be eligible for unemployment compensation.
Okay, thank you.
Let me add one point on that, just to flag something that because health insurance is a real concern of many people. So if your employer is not paying you, they may not be providing you with health insurance, and that can be an issue. There is an encouragement within the federal law of employers and to consider the work share programs. So that is, you can, if you don't feel that you can keep everybody on full time, and so you're thinking about laying off half your staff, instead you might put everybody on part-time, and the government might be able to make up the salary difference if you're in an established work share program. My understanding is the AFL-CIO has a lot of good information on that and how those programs work. I didn't know if you know other sources, Sherry, but there might be some discussions happening now in different businesses and between staff and employers about how to get through this, and that's one option.
Okay.
Yeah, thank you, Blue. That's right. And definitely let's lift that up. It is better to stay employed because of the health insurance issue, also because Undocumented workers, although entitled to sick leave, are not entitled to unemployment compensation. So there are many reasons why it's much better to stay employed. And that's really why Families First was enacted, was to try to make it so that small businesses, because you can get this money back for under 500 in terms of your tax credits. So, and then you've got all these other loans and things that are under CARES. So it is better to stay employed. It's just the problem is that so many businesses now are not able to keep people on the payroll.
Right, that's right. Just to dig in a little bit to the domestic worker issue, I think also child, care workers as well. But Tatiana is making the point that many are undocumented and they're being paid off the books. So, which raises that whole question for lots of people, but I think some of these things there may not be a solution for, and the solution might have to be long-term, So I'm really glad that Hand in Hand Domestic Employers Network is on today and can help us find ways, to help with that. One question that did come up, which I think is interesting, is about hazard pay. Is there any talk about hazard pay for the healthcare workers? This Equal Pay Day, which is March 31st, we really focused in on these essential workers who are putting themselves at risk and their families at risk. And these are very often very low paid workers that we've been, working to get better benefits and also, but now I think Americans see how important they are. But right now they are working in hazardous conditions. Is there any talk of that happening is one of the questions, which I think is.
Well, there is a lot of effort. I laid out a couple of kind of a list of things that many different advocacy groups are coming around in terms of essential workers, and that is hazard pay, paid sick and family leave, and protective clothing, equipment, testing,
Right.
masks, and the ability to sanitize and clean at your work site. There's one of the big problems now that I see and experience is you've got people working. First of all, they don't feel they have any choice about working. They don't know how else they're going to survive and pay their families. They're paid at very low wages, and they get to work and they are not able to sanitize, to clean, and there's no enforcement of health guidelines. They absolutely need hazard pay, but they also have to have the ability to stay safe and to stay home if they are exposed or get sick. And so, yes, many of us are working on those and on laws and talking with both the state and the federal government on what we can do to include that in upcoming legislation.
Terrific.
And I think on the undocumented and domestic worker situation, as I said earlier, we're establishing some important precedents here in passing laws that do not exclude undocumented workers and do not exclude independent contractors. But enforcement is the key. And in these times, we're not seeing a lot of enforcement, and we're also not seeing a lot of outreach and education. So people maybe don't know their rights, or even if they have their rights, there's nobody there to monitor and make sure that these are being enforced or have penalties if they are not. So that's a real concern.
Right. So one of the reasons that care workers are low paid is just our whole attitude around women's work and the value of women's work. Devaluing what a lot of women do, which is work in caregiving professions. And that's something that Power has been trying to focus in on and will continue to do so, I think, maybe now with more understanding of the public and also of our leaders. So, really hope that that's something that moves forward. We can make some progress in the next year or two on that, and we'll focus on that. Another question was about these companies that are 500 and plus. You think they're the ones who are covered, but there's so many that aren't, as you point out, Blue. So what can be done? I mean, I know that I've read about efforts with many of the large companies that are serving people, like Kroger's and other places that actually have added benefits now, and they did it because of public pressure.
Mhm.
So I think that there is, an effort to pressure companies, to pay their workers better and also to give them the leaves that they need. Is there anything else that's organized that Sherry, you or Blue know about how can we help get those really large corporations to do, what they should do for the workers and for the American public?
Yeah, I mean, I think that these are lessons learned here. The idea that the over 500 got themselves exempted from Family First, I mean, it shows the amount of power they have and the amount of entree they have to the White House and to the leadership in the Senate, because there's no excuse for that. I mean, it's just ridiculous. They are better able to provide sick leave to their workers, and as Blue pointed out, there are 6.5 million workers who don't get any paid sick leave, even though they work for these larger companies. But number two, even those who do get the sick leave, they get demerits, they get penalized when they use it. And that there's nothing in Families First that's going to change that for the larger companies. So yes, I mean, we are trying, we are trying in Congress in Corona 4 to remedy that, but they have a lot of power. They really do. And I think that is something that we really need to understand and work through as we're trying to get rights for people that they deserve as working people.
And I would say that there are efforts now. I mean, you've helped in San Francisco, I know, to have a city law that addresses this and fills gaps. We're not sure what our state legislature is going to do, if they're going to come back or not, but I believe we should advocate at the state level to fill those gaps.
I think that's a really good point. We are working around the country on filling gaps. As Blue said, we just did that in San Francisco, Los Angeles, San Jose, Chicago is working on a very good law. Massachusetts and Philadelphia we're working with as well. Unfortunately, in some ways, this is what we did pass, an emergency sick leave bill, but we passed it before Families First, and now we know better what the gaps are. And I think, if there was any possibility, and certainly Blue is, leading the charge in terms of New York State paid sick and paid family. So, and we are involved as well. And if there is any chance of having the legislature do more, I think, we can talk about that, and be great to have everybody's support.
Let's move to the next slide as we close. This will be, in the packet that you have, and we'll be sending, these links again with, all of the links to the great information ABB's put together, and Citizen Action, Family Values at Work, and other groups. So, here are just some of the things we just talked about, but we will get that to you. I think the only one we didn't talk about was the Disability Advocates and their We Are Essential campaign, but we'll send out more information of that. Also, I've been really interested in this 500 plus. I've been tracking, there's some websites that are tracking those numbers and showing how public pressure is changing that. So we'll add that. If you're not on the PowHer New York, update list, just go on the website and make sure that you're getting our e-blast by, putting your name and your email address in. So we will, we'll be following up on this, but, this is what the network has been doing and will continue to do. I think the pandemic just lays open and exposes, those inequities that we are aware of. But now, Sherry, I think you mentioned, and also Blue, maybe now we're going to have a chance to make those permanent for the future and improved, because we have Americans that think have a much better sense of what, makes our country run. And a lot of it is on the labor of women, which we focus on. So we'll continue to do this work together. If you have other questions, you can either send them in or quickly put them in the chat. and we'll definitely get them to the experts. So I want to thank Blue Carragher and Sherry Lawant for just taking the time and to do this with us today, to share this information, and for all the work you're doing to move forward this issue, help people know what to do in this emergency, and then improve the lives of so many New Yorkers with the work that you've done on paid family leave and paid sick days, which goes into effect in January. So thank you everybody for being on the webinar today. And this is just part of a series that we're doing in response to the pandemic, but also as part of our Power the Vote campaign. These issues are the issues that we need elected officials or those who want to represent us. We need them to think about these issues and tell us, what are you going to do to improve the lives of women around these issues. So it's not separate from what we're going to be talking about in the next months about elections. It's part of that, and we need leaders, and particularly we need more women leaders, who are going to take on these really major challenges that New Yorkers and Americans have in the future. So this is part of a continuing conversation, and I look forward to having everybody part of that on future webinars throughout the rest of the year. Thank you so much, and just be in touch by email, and we'll pull in you or get your questions answered in any way we can. So have a great rest of your day.